Hi there, I'm Dr. Matthys, and this is Jenny, and today we're going to talk about facial fillers. There's a number of fillers that we use in the central face to help erase the years that people don't want on their face or in their folds. We can augment the folds around the mouth, we can help give people lips they don't have, we can even give people cheeks when their age has taken that away from them. But today, Jenny and I are going to work on her folds. Now she has very mild creases in her folds. They call them the parentheses around the mouth, and we always treat what bothers people, so I'm not ever one who will judge or assess what people want to do. I let them tell me what they want to do. I don't tell them what they want to do. If they ask me for questions or they ask me for comments, I'm happy to give them, but I always want the patient to tell me what their number one concern is, and then we'll address that or two concerns at each visit. So today we're going to address Jenny's folds, and we're going to use a product called Juvederm, and it's a hyaluronic acid. It's a natural part of your body, so conveniently for us, we don't have to do any pre-testing to make sure that she's going to be allergic to it, because there's no allergy, because people make this in their body. So we're going to inject both sides today, and this is the product that we use. And this product has numbing medicine or anesthesia in it. So conveniently for Jenny, it won't hurt quite as much. But typically, patients have very little discomfort with the procedure. Once we put the needle in a couple of times, and the numbing medicine that we've had in there does the rest, and it's really not very uncomfortable. And Jenny will tell you honestly how she's doing throughout the procedure. So let's get started. So first we have a 4x4 here. We have our medicine, and we'll ask Jenny just to put her head back. We're going to start on the right side of her crease today, and we do what's called a linear threading approach, to where you put the needle in and then pull it back and put medicine in as we pull the needle back. So we'll get started. All right, Jenny, are you ready? I'm ready. She's ready. Okay, good. All right. So here we go. So we'll put the needle in and we'll start injecting the medicine. So here's the little needle right here. Here's a stick now. Little stick there. I'll put a little medicine in right now.
It's not bad at all.
So we're adding medicine in, and then we're pulling the needle back, and then we're continuing to put medicine in. So we're just going to do this all the way down this fold. And then when we're done, we're going to massage the fold to make sure it's nice and smooth. How you doing, Jenny?
Great.
She's doing great. This is a nice, smooth product, so there won't be any bumps or lumps, especially after we smooth it all out. How you doing, Jenny?
Good.
Good. So she's just a rock star. She's doing great. We're going to just touch up a few areas, and then we'll massage some. She'll be good to go. So this is typically about how fast it takes to do the procedure. And then we'll just massage the area in just a moment. All right, excellent. So I'm going to set down the syringe, and we're just going to massage that area. How we have to massage the area is I'll have Jenny open her mouth, and I'll put my index finger in, and then I'll use my thumb as the massager to make it nice and smooth. And it doesn't really hurt her because she's got numbing medicine in there, and I'm not pushing too hard, I'm just trying to smooth it out. Okay, great. And then what we'll do is we'll give her some ice to hold on there, because we don't want her to bruise. She can hold that ice on there. We'll have people hold ice on there about 10 minutes, 5 to 10 minutes, 3 times a day for the first day or two, and we'll ask them to sleep on their back so that so they don't push the medicine around. The medicine isn't stable there, so if you massage this area or you push the area or you sleep on your face, you can just push the area, push the medicine right away. So we ask you not to really massage the area too much for the first day or two, and then we encourage you to come back in 2 weeks so we can show you your before and after photos and make sure we've met your expectations. So there's one half, and we'll do the other half. Okay, so we did Jenny's right side here, and you can kind of see a little bit. You can push. It's a little bit red, and some of the bumps there will go down within the half hour or so. It's just some people get a little inflamed when you stick the needle right in their skin, but she's already very happy. She's just red from the ice pack. We'll have people use ice, like I said, about 5 or 10 minutes 3 times a day. So now we're going to do her left side here. So We'll have Jenny look over towards the camera. Here's one stick for her. Here's a little stick now. So now we're just pushing a little bit of medicine in here. Or pulling back with the needle. Good, and then we're going to put a little bit more in here. One back, good, good. Okay, now we're going to go inferior to that and continue all the way down and fold. Okay, good. How you doing, Jenny?
Good. Just a little pinch, not bad.
So remember, there's numbing medicine in this medication, so even though she didn't have anything on her skin, we have numbing medicine in this to help make it not very tender for her. Okay, good. So I'm going to have you put your chin down just a little bit. Great. So we're going to make sure this is nice and even. Good, good. So then what I'm going to do is I am going to put a little Vaseline or Aquaphor on the area, and then we're just going to massage this area to make it nice and smooth. So I'm going to have Jenny open up again, and we're going to massage. So we just massage it to make sure it's smooth so you don't feel any product in there. Close your mouth, good. Now I see a little area that's just not quite even to my liking, so that's why we'll put a little more medicine in here. But she should be pretty numb where we're going to inject the area, because she already has numbing, she already has product there with numbing medicine in it. She's getting those little bumps again, but they go down. It's just a little inflammatory reaction where the needle goes in. It's not any product because the product's not that high up. A little bit more medicine here. Again, she's numb where we're injecting it because she already has product there. Okay, good. Now we'll just look at both sides. She's done really great. Everything looks really good. And so that's the injection of the filler into the parentheses of the face. If you have any other questions, you can visit our website at sunflowerdermatology.com, or call us, or visit our Facebook page where we put all of our information. Thanks so much. Bye-bye.